The elevator broke down on floor 15. What started as a minor inconvenience for Dr. Sarah Ortiz became a life-or-death emergency when her fellow passenger went into sudden labor. Sarah had been pulling 18-hour shifts for the past 3 days, and all she wanted was a decent cup of coffee from the café on the hospital's 20th floor. The blonde surgeon's piercing blue eyes showed the exhaustion that came with saving lives around the clock, but she had one more surgery scheduled before she could finally head home. The elevator was crowded with the usual mix of hospital staff, visitors, and patients. Sarah found herself standing next to a young woman who looked to be about 8 months pregnant, nervously clutching what appeared to be discharge papers from the maternity ward. "First baby?" Sarah asked with the warm smile that had put countless patients at ease. "Actually, my third," the woman replied, shifting uncomfortably. "I'm Lisa Chen. Just had my final checkup. The doctor said I have at least 2 more weeks." Sarah introduced herself and was about to ask about Lisa's previous deliveries when the elevator suddenly lurched to a stop with a grinding mechanical sound that sent everyone's stomach into their throat. The lights flickered once, twice, then went out completely. "Ladies and gentlemen, please remain calm," came the maintenance voice through the emergency speaker. "We're experiencing a power grid failure. Backup generators will restore elevator service within 20 to 30 minutes. But 20 minutes was about 19 minutes too long. "Oh no," Lisa whispered in the darkness, her voice tight with sudden panic. "Oh no, oh no, oh no." Sarah immediately activated her phone's flashlight, illuminating the small space filled with increasingly worried faces. "Lisa, what's wrong?" "I think—" Lisa's words were cut off by a sharp intake of breath as her body doubled over in pain. "I think the stress of being trapped triggered something. These aren't Braxton Hicks contractions." Sarah's medical training kicked in instantly. She quickly assessed Lisa's condition while the other passengers pressed against the elevator walls, giving them space. Lisa's contractions were coming every 2 minutes, active labor, progressing rapidly. "How long have you been having contractions?" Sarah asked, her voice calm despite the surreal situation. "They started when the elevator stopped," Lisa gasped, "but they're getting stronger." "Sarah, I think this baby is coming now." The other elevator passengers, a janitor, 2 nurses from pediatrics, and an elderly visitor, stared in shock as the reality of the situation hit them. They were trapped between floors with a woman in active labor and no medical equipment except whatever they could improvise. Sarah had delivered babies in operating rooms, but never in a broken elevator. "Everyone, I need you to stay calm," Sarah announced, her authoritative voice taking charge of the situation. "I'm Dr. Sarah Ortiz from surgery. Lisa is going into labor and we're going to help her deliver safely." "In here," squeaked one of the nurses, "with no equipment." "We work with what we have," Sarah replied, already mentally cataloging available resources. "I need someone to call 911 and explain our situation. Someone else, find anything we can use as clean towels or blankets." Sarah helped Lisa sit on the elevator floor, using her own lab coat as a makeshift cushion. The cramped space, emergency lighting from multiple phones, and the stress of being trapped created a surreal birthing environment that would have been comical if the stakes weren't so high. "Sarah," Lisa panted between contractions, "my other 2 labors were really fast. I think this baby is coming in the next few minutes." Sure enough, Sarah's examination confirmed that Lisa was fully dilated. There was no stopping this delivery. Ready or not, they were about to welcome a new life into the world in the most unlikely of places. "Okay, Lisa," Sarah said, positioning herself with practiced efficiency. "On your next contraction, I need you to push." The next 15 minutes became the most unconventional delivery of Sarah's career. Using her car keys to cut the umbilical cord, shoelaces from the janitor to tie it off, and T-shirts donated by the other passengers for warmth, Sarah guided Lisa through a delivery that would have challenged experienced midwives in fully equipped birthing centers. "I can see the head," Sarah announced, her blue eyes bright with excitement despite the bizarre circumstances. "One more big push, Lisa." At 3:47 p.m., between floors 15 and 16 of Metropolitan General Hospital, baby Emma Chen made her dramatic entrance into the world. The tiny girl announced her arrival with a healthy cry that echoed through the elevator shaft, bringing tears to everyone present. "She's perfect," Sarah whispered, carefully cleaning the baby with sterile wipes from her purse before placing her on Lisa's chest. "Absolutely perfect." The other passengers cheered softly, wiping away tears as they witnessed one of life's most miraculous moments in the most unlikely setting. The elderly visitor, who turned out to be a retired nurse, helped keep Lisa comfortable while the pediatric nurses assisted with aftercare. 23 minutes later, the elevator finally lurched back to life. When the doors opened on the ground floor, the waiting emergency medical team was shocked to find not a medical crisis, but a successful delivery performed by the hospital's own doctor. Sarah Ortiz, using nothing but improvised equipment and surgical skill. Dr. Ortiz, the paramedic shook his head in amazement. "We've responded to a lot of elevator emergencies, but never one that resulted in a healthy baby." As Lisa and baby Emma were transferred to the maternity ward for routine checkups, Lisa grabbed Sarah's hand one more time. "Thank you," she said simply. "Emma's going to have the most amazing birth story to tell." Sarah smiled, her exhaustion forgotten in the joy of the moment. She's going to be telling people she was born between floors for the rest of her life. 3 days later, Sarah received a text message with a photo. The image showed baby Emma Chen wearing a tiny onesie that read, "Born in elevator, delivered by the best." The accompanying message from Lisa said simply, "Thank you for making our family's craziest day also our most beautiful." Dr. Sarah Ortiz, the blonde surgeon with piercing blue eyes who had dedicated her life to saving others, learned that sometimes the most memorable medical moments happen not in operating rooms, but in broken elevators where life finds a way to surprise everyone. And from that day forward, Sarah always took the stairs when she just wanted coffee. Sarah Ortiz's elevator delivery proves that medical emergencies don't wait for convenient locations or perfect equipment. Her story reminds us that sometimes the most beautiful moments in medicine happen in the most unexpected places, when skills meet compassion and life finds a way. If Dr. Sarah Ortiz's elevator adventure amazed you, subscribe to The Frontline Voice for more incredible real-life medical moments. Hit like if you believe doctors are ready to help anywhere, anytime. Tell us in the comments, what's the strangest place you've ever witnessed a medical emergency? Share Sarah's story with someone who needs to remember that life's most precious moments often come without warning. Until next time, remember that heroes don't choose their moments. Moments choose their heroes.